Kochi. In today's session, I'm here as a bridge between IT and you, the caregivers. I want to empower you with confidence to handle digital tools more securely, just like how you confidently manage patient care. Let's take a quick look at what we'll be covering in today's session. This isn't a technical training, but a practical awareness session tailored specifically for nurses. We'll move on to common threats you might see in a hospital setting, things like phishing emails or suspicious links. Importantly, we'll talk about what to do when something goes wrong. We'll touch on legal and ethical responsibilities you hold. And finally, we'll test your instincts through interactive scenarios where you decide what's safe and what's risky. This session is meant to be engaging, informative, and something you can take back to your wards and clinics right away. Let's move ahead. Let's take a look at some of the biggest healthcare cybersecurity breaches of 2024 to understand just how real and impactful these threats are. Starting with Change Healthcare. This was the most significant breach in healthcare history. A ransomware group called Black Hat targeted their systems, affecting 190 million individuals. It took more than 9 months to fully restore services. The disruption impacted billing, claim processing, and core hospital operations. Reports suggest a $22 million ransom may have been paid, showing how costly these attacks can be. There are other examples like Cancer Foundation, Accession Health, as you can see. I came prepared for a 30-minute, but it's like I have 15. So I'm going to just breeze through all these slides. Now let's talk about your role, not just as the nurse, but as the data guardian. There's a common misconception that cybersecurity is the sole responsibility of the IT department. While IT certainly sets up defenses like firewalls, secure servers, and access controls, the reality is technology is only as strong as the people using it. Think about the many digital tools you interact with every day. Electronic health records, lab result systems, medication dispensing tools, patient monitoring devices, even mobile apps for telemedicine. Every time you access these systems, you are entering a digital ecosystem where sensitive data is being handled. Now imagine accidentally leaving a workstation unlocked or using a personal USB drive on a hospital computer. These may seem like harmless lapses, but they can open the door to data breaches, malware infections, or worse, putting patient safety and hospital credibility at risk. So why should we care so much about cybersecurity in healthcare? The answer lies in the one thing that binds us all: trust. When a patient walks into a hospital or clinic, they're not just sharing their body, they're sharing their life story, their illnesses, their medications, their financial information, sometimes even deeply personal and emotional histories. They trust us to protect that information with the same care we give to their physical health. Now here's a sobering fact. Healthcare data is one of the most valuable types of data on the black market. It's more valuable than credit card numbers. Why? Because patient records contain everything: identity, medical history, family background, billing details. A stolen patient record can be used for identity theft, insurance fraud, or even blackmail. That's why cybersecurity isn't just about compliance, it's about preserving the integrity of our work and protecting the people we serve. This brings us to the next question. What exactly do we need to protect? The answer is simple. Any information that can identify a patient or relates to their care. This includes names, contact details, admission dates, diagnosis, test results, imaging, prescriptions, billing data, even emergency contact. But health records. Consider notes scribbled on paper, printouts lying on unattended desks, conversations held in corridors where others can overhear. These too can inadvertently expose sensitive information. Let's also not forget about photographs and videos. The guiding principle here is that it's about the patient, and if it can reveal who they are or what they are being treated for, it must be protected. Whether digital or physical, seen on a screen or heard in passing, it is your responsibility to handle it discreetly, ethically, and securely. Now that we know what needs protection, let's take a closer look at the kinds of cybersecurity threats many encounter in a typical healthcare setting. Phishing emails are fraudulent emails designed to look real, maybe claiming to be from IT, HR, or even hospital management. They often ask you to click a link or download an attachment. One click could allow hackers to access your system. Ransomware is the type of a malware that locks your computer and demands payment to resolve the access. In hospitals, ransomwares can paralyze critical systems like patient records, lab systems, or even surgical equipment handling. Tailgating and insider access. Not all threats are digital. Someone following you into a secure area without a badge or logging in using your credentials can be just as dangerous. Let's now talk about something very practical, cyber hygiene. Just like hand hygiene helps prevent infections, cyber hygiene helps prevent digital infections like viruses and malware. Here are some basic but powerful habits to follow. Lock your screen. Every time you step away, even for a minute, patient data should never be left open on a screen. Never share passwords. It may feel convenient to give your login to a colleague for a quick task, but it puts both of you at risk. Use strong passwords, avoid common names or birth dates, use a mix of upper and lowercase numbers, special characters. Don't click unknown links or attachments, even if they look urgent or familiar. These habits are small, but collectively they create a strong defense. Communication is essential in healthcare, but the way we communicate can make or break data security. With WhatsApp, text messages, and personal email becoming part of everyday life, it's easy to forget that not all platforms are secure or compliant. Remember, being cautious with communication isn't about slowing things down, it's about protecting the trust, staying compliant with law, and keeping patients safe. Despite our best efforts, mistakes can and do happen. What truly matters is how we respond when something goes wrong. What should you do? Stop and report immediately. If you click something suspicious, unplug from the network if possible and call IT. Don't try to fix it yourself. Avoid running antiviruses or restarting the system. You might inadvertently destroy evidence or worsen the situation. Document the incident. What did you see? When did it happen? What actions did you take? These details help IT to understand the scope of the threat. This slide summarizes the 4 key dimensions where lapses can lead to patient confidentiality breaches. In India, we operate under the IT Act and emerging healthcare-specific frameworks like DISHA, that's the Digital Information Security in Healthcare Act. These laws are designed to safeguard protected health information just like HIPAA does in the US. Many breaches occur not because people intend them, but because they didn't know something was a violation. That's why legal compliance isn't just for management. It must be understood by everyone, including nurses. Professional conduct. On the top right, we see another critical source, professional conduct. This includes actions like discussing patient cases in public spaces, or accessing records without legal necessity. These are often not seen as cybersecurity issues, but they are. Unauthorized access, even if accidental or well-intentioned, is a breach. Nurses are held to ethical and legal expectations of privacy that includes refraining from casual hallway conversations or leaving patient charts exposed at the nurse's station. Now move to the lower left. Ethical lapses often arise from a lack of training or unintentional mistakes. Technology use. In the lower right, we see threats related to how we use technology, unsecure communication through apps like WhatsApp, posting about work, even without names on social media. All these paths lead to what's in the center, that's the patient confidentiality breach. Whether it starts with lack of training, a casual conversation, or an unverified app, the consequences are the same: compromised trust, potential legal action, and even patient harm. Let's now shift into the interactive mode with a real-world scenario. I'll present the situation, and you can take a moment to think about what you would do. The scenario is, you receive an email claiming to be from your hospital's IT department. It says your login has expired and urges you to click on a link immediately to reset the password. The email looks convincing. It has your hospital's logo. Ask yourself, what would you do? Show of hands. Who picked A, B, C? Cassie's you. D? The answer is C. Now this is a classic example of a phishing attack. The attacker's goal is to get you to click without thinking. The urgency is manufactured. The branding is copied to make it look trustworthy. If you click the link, you could be redirected to a fake login that captures your username and password. What should you do? First, pause and check the center's email address. Is it a hospital domain or something slightly off? Second, don't click the link. Instead, contact your IT department through a known phone number or internal system. Third, report the email. Many hospitals have a way to forward suspicious emails to IT for analysis. Here's a second scenario. This one plays on urgency and familiarity, two tools attackers use frequently. You receive an email with the subject line, updated COVID protocols, mandatory review. It appears to be from hospital management. It has a file attachment, a .zip file. This is a tricky one because the topic is serious and time sensitive. During COVID period, we got used to seeing updates all the time. That's exactly why attackers use topics like protocol, policy, updates, or emergency measures to create pressure. Let's talk about .zip files. These are compressed folders that can contain many files inside, sometimes including malicious scripts or hidden viruses. Once opened, malware like ransomware can be silently installed onto your system. So what's the correct course of action? Don't open the attachment, check the sender, verify the message by contacting hospital management or through IT, report the email. Let's go to a final scenario. This one touches on something many of us experience, especially in fast-paced environments. A doctor you know and trust sends you a message via WhatsApp. He's requesting a patient's lab results urgently. You've communicated like this before. What do? The situation can feel harmless. It's a known person, it's urgent, and you want to help. But here's the issue. WhatsApp is not an approved or secure platform for patient data transmission in most hospital settings. Why? It doesn't offer proper audit trail. There's no institutional record of who accessed the information. Messages can be forwarded back up to cloud accounts that are not secure. So what's the better option? Inform the doctor that while you understand the urgency, data must be shared through official hospital systems, whether it's the EHR platform or a secure internal app. Patient confidentiality isn't just a hospital policy, it's a part of your nursing code of ethics and is backed by law. By saying no to insecure communication, you are protecting the patient, the institution, and yourself. As we wrap up today's session, I want to leave you with a few key takeaways that sum up the heart of what we've discussed. First and foremost, cybersecurity is a shared responsibility. While IT builds the systems and provides the tools, it is each of us, especially nurses on the front lines, who are the eyes, ears, and gatekeepers of patient data. Your role is not just medical, it's digital too. Let's revisit some practical habits. Always lock your screens and log out when stepping away. Use strong passwords and never share them. Be cautious of emails asking you to click links. Avoid sharing patient data or over personal apps like WhatsApp or email. If something seems suspicious, report it immediately. Early intervention can prevent a major incident. Think of cybersecurity as an extension of the safety protocols you already follow in your medical practice. Just as you wouldn't reuse a glove or skip a patient ID check, cybersecurity works best when it becomes second nature, part of your professional discipline. Finally, I encourage you to carry this awareness back to your teams, start conversations, ask questions, and if your hospital doesn't already have a cybersecurity refresher or clear policies, speak up. Change starts with awareness, and awareness starts with you. Thank you for the care you bring to your patients and for taking this extra step today to care for their data and digital safety. I hope you feel more confident, more prepared, and more empowered as a result of this session. Thank you.
You, Ms. Pavitra, for that very enlightening talk, and I'm sure that your tips of cybersecurity has been deeply embedded in the younger generation and also the supervisors. I feel there is a need for us to teach digital topics right from the first year of nursing in the curricula and teach them how to protect the patient data as well as the data of the hospital right from the first year of training so that when they pass out they are well prepared to, rather than jumping into the fray and then learning that would be a little costly. So thank you again for that wonderful talk that you have given. Now may I invite Mr. Sajid Matthews from Baby Memorial to talk on improving nurses' productivity through digitalization.
I consider it as an honor and privilege to be with you in the ANEICON 2025. Thank you for this opportunity to present my thoughts on how digital technologies can be used to improve productivity. This is the topic I am given, plan to higher productivity among nursing colleagues. I want to put in my different perspective how digital technologies can be used to ease up nurses from the system inefficiencies and administrative burden so that they can focus on what they are called for: care, connect, and heal the sick. As Madam has been mentioning, now INC has come up with a program on digital leadership. That's already such a program is there, so I encourage you to, that shows the importance of digitalization or the technology in today's healthcare. So the current reality, before I take up the role of CTO in the hospital, the previous role I was wearing multiple hats. That's of the people management, operations, and technology. In our day-to-day meetings with Mrs. Gracie Mathai, Basically, Madam, me and CN used to fight over the resources. Always the productivity or the number of resources come. So always we have, resources come up with, I don't have enough nurses to do this one, when you want to open a new one, or when you have sudden increase in patients. I used to say, okay, this is my KPI is to keep the cost at bay. So we always fight. So then I decided, so rather than fighting, how do we come together to help each other? So today I am going to present most of our digital innovation that comes from the love and trust for the nursing colleagues. Me, one of my clinicians, so Dr. Bijoy and Elizabeth team, together we did a couple of digital innovations. I'm going to present and take you through those digital innovations, which may inspire you to leverage digital technologies for improving nursing productivity and ease them from the administrative burden so that they can focus on care, the compassionate care and the empathetic care which you are all practicing. The reality, so we know around 40% of your time is spent on administrative tasks. There is always this staffing shortage, and with high attrition, all levels you all struggle to keep the quality of care and also meeting the nurse patient ratio. It's always a challenge. And all the communication between the healthcare professionals is always fragmented. And in our case, we had some challenges. Some of the innovations came out. How do I protect? How do I help our nurses from their predicament experiences with clinician? So I will come to that later. And a lot of tasks is manual, repetitive in nature, copy the same data from one form to the other, and do various assessments and do the recording. And then there is the JCA and NABH, and we have the complaints, pressures, documentation, and which is all impacting the morale of the staff nurses and also the time which they need to efficiently spend at website is getting compromised. So there are various digital tools which are available. It's very mature now that cognitive capabilities of computing is in par with the human cognitive capabilities in terms of natural language processing, computer vision, and many areas, artificial intelligence, machine learning. And also we are partly witnessing a paradigm shift in healthcare. That's about from disease care to wellness and preventive care. The focus is shifting from episodic nature in our care to a continuum of care, brick and mortar hospital to continue, the connected healthcare, and care is now being delivered, high quality care is now being delivered at home. Paper-based records to AI-driven healthcare records. There is information obsolescence in the past. Now, because of the information explosion, so the patients are also equally equipped with the knowledge and they come and question. And from outcome focus, we are more moving to experience focus. How digitization can help? So that is reduce on documentation. In the industrial lab, I am not going into the details. It can improve in communication and coordination, enhance patient safety, simplify your routine tasks, enable better time management, and improve job satisfaction. So I am going to take you through some of our experience, the BMH experience in using digital technology in improving nursing care or releasing their administrative burden. We have come up with a platform, so the digital platform, we affectionately call it Nightingale, which has various features for generating a nursing care plan using generative AI. There is an activity-based staffing tool and consultation notification to doctors automatically through digital technologies. There is a patient simulation or communication simulator being created to improve the communication of the nurses involved. Incident reporting tools with AI-powered incident reporting. There is a knowledge base which is generated or created through generative AI, which works as a ready recommender for the nurses. Counseling companion for the nurses, given a particular disease condition, how to counsel the patient and relatives, a concierge application where the patients and relatives can self-serve using digital technologies, patient status tracker while in OT, operation theatre or delivery suite, how can we securely how we can communicate the status to the patients and relatives, discharge tracker, and also the in-house navigation tab, internal hospital navigation tab. So it is all developed in-house at a very low cost. So it's in-house implemented digital innovation using open source technology, leveraging cloud technologies and generative and conversational AI features. So first of all is nursing care plan. So the hundreds of nursing care plans are being previously manually prepared by the nursing colleagues in our hospital. So now it is all using generative AI. We prepare it, which saves at least average 10 minutes of their time. We provide the symptom diagnosis and the nursing diagnosis system will generate a care plan. The next is an acuity-based staffing system. So the nurses will assess the acuity, rating acuity score of the patients, and also a lot of these scores are pre-filled. The ratings are pre-filled from the previous assessment. So it makes easy for the nurses to do an acuity score. And we have nursing competency score part of the intervention and prevention system. So it matches the competency, the roster, and the acuity score, and comes with a very efficient way using an AI algorithm, the staffing allocation. And it provides a tool for the nursing leaders also to look at where we have excess resources, where the nurses can be moved from one location to the other part. So it gives both at the system level, nurse manager and the nurse leaders level, a tool for them to do the staffing allocation as well as to optimally allocate the resources. So it's the acuity score of the patients and the competency score from the CRP system, which is run through an AI algorithm which gives a suggestion for optimally deploying the staff. Next is an automatic consultation notification. I said it came from a predicament of the nurses because it's every other day I hear from Elizabeth that okay, the doctors complained that they were not reached out on time. That is why this was missed. The poor nurse, she would have tried to call in multiple times, maybe busy in the theatre or maybe attending to something else, but there is no trail of being contacted. So they have been unnecessarily blamed for this communication which didn't happen. We thought how do we leverage technology to address this system. So we came up with that system. So we have the doctors directly there. The nurse can choose which doctor to target, and the patient details are there. So connect the patient details and for the purpose for which the doctor will be consulted. So click a button, the system will try multiple times, either based on the priority, either to a voice call or to a WhatsApp or app-based notification. And this also has a checklist for the doctor to do the next day rounds for the routine cases. In the case of emergency or immediate priority, it is a voice call and it will keep trying until the doctor picks up. Or the doctor can also respond back saying that I am busy, give the cross consultation to another doctor. So that's the and various dashboards and logs associated. So it's no more the nurses are being blamed for not reaching out. So the evidence is there, the doctors are either not picking up or they are didn't pick up. So that's how the technology is done. This is an interaction simulator. It's basically to improve the nurses' communication and website. Various scenarios are being made to the nurses and to which they can respond. How do they answer it? Then there is an AI generative AI based tutor will try to help them improve the communication. So another one is a ready webinar. In the past, people used to carry those small webinar or ready webinar books with them. So we thought okay, use a digital tool. So in various areas of nursing care, we have generate content. So basically, in investigations, how to safely do the investigations, how to catch, administer a procedure, or medication related information, surgery related information. That's all for the nursing colleagues to use at work. It works as a ready reference. It's been generated through generative AI and validated by the nursing leadership team. So it's been used. Another is that counseling companion, both in English and Malayalam, given a particular health condition, it gives the content, what are the topics or tips to counsel the patient in an effective way. Another is a concierge application, so where by scanning a QR code at the website, the patient or lady can directly reach out to various other services, that's for housekeeping, F&B, or for maintenance activities. So it's no more nurses are bothered to reach out to the respective department. Another one is the labor room, or a working tracker, where from the inside the theatre, the nurses can update the status, the relatives or their other family members can simultaneously view. This is shared to a secure WhatsApp link or an SMS link. The status is being updated. So currently, how do you see the training status? Real time you get the training status. So similar to that, and also we push all the education material, also videos and other relevant materials to this portal. Discharge, that is also another time when the nurses are being ordered. Okay, the moment you are getting discharged, oh, my bill is ready, my discharge summary is ready, many other things they are being ordered to track. Now it is the nurses, the patient or relatives can self-serve by a tracker, and the relevant people at each of the stage, their number is given, including payment can be done through digital means, easing out the nurses' burden. It's another innovation we did. It's being rolled out. That is an indoor navigation system. So moving from one place to the other, we have 3 different roads, and moving from one location to the other, it's always a challenge for a newcomer to our facility. So we are going to paste QR code at each of the locations. This is an idea I got from Cochin International Airport. They have put the QR code for the indoor navigation system. So these are some of the digital innovations we did together with our nursing department, nursing colleagues, to free them up from their administrative burden, the routine, repetitive work. So the impact of doing that, we were able to save this many hours of nursing hours, free up that from their regular administrative person. The number of calls which are being at about 5,000 plus consultation calls, at least 10 2 or 3 minutes to reach out to the doctor, talk to the doctor. In spite of all this automation, there are doctors who still insist that I want a girl to call me and talk to me. I don't know for what reason, but the technology works very well, but there are personal preferences also. So the number of care plans we generated in a month, the knowledge-based articles that we have in the system, so that it enhances care coordination, balanced work, and overall nursing staff. So some of the indicators that even the nurses itself, the feedback was that was their satisfaction, job satisfaction has improved, and the net promoter score from the patients also improved after the implementation. Okay, what are the lessons learned in implementing? What are the challenges that the barriers in digital innovations? Definitely there is resistance to change. It comes from all quarters, especially you see from the clinician side, some of the senior people. So we need to, it's not about digitalization, it's not about IT alone, it is a cultural shift. So we need all to support that cultural shift. Technology is there, so it is, don't see technology as an additional burden. The technology is really a friend which can help to ease out used in the right manner. And the budget, always we have two people talk to the management, there is budget constraints. My advice would be do it in-house with other set of people, and also pick up areas where we have maximum impact with lower investment, which will convince the management to subsequently invest for your digital innovations. Lack of digital skills, yes. So we need the new generation, they are all tech savvy, so we need to have programs in house to improve the digital skills. There are, at the same time, we have come there talking about the data privacy concerns. It's there, but we need to be addressed in the right manner, and we need to have the management support to implement such systems. So, shaping the future of nursing, embrace this opportunity. We are at the right moment in history where technology is playing a role. Don't worry, the nursing is not going to be the profession that I am coming from, that is software engineering, so which is going to be, I may be replaced in coming years with an AI, but the future for the nursing is you will be empowered with the digital AI technologies which will help you to focus more on your core competency. And on the leaders here, in implementing digital technologies in your work, in your respective work area, you can see the benefit of it. Share the feedback. It's always about suggest or advice for innovating, incremental innovation, which is happening in a house, which you can take the feedback from the people and then you can further improve on rather than going for a big bang approach with some standard market product. Invest in your skills, so you need to acquire certain digital skills also to survey the future workplaces. Push for better system, have a voice, nursing voice for a better system, many again will come from. 2 more minutes I will finish it, so don't worry. So push for better systems, be part of any of your IT initiatives in the organization, and remember the word. So more time is spent at the website, that's what our purpose. So it is not about the IT project, it is a cultural shift. The nursing leaders are essential to drive that shift. When we free up nurses from the burden of inefficiency, we give them space and time to do what the humans can do, to care, to connect and heal. So let us not ask the nurses to work harder, let us help them to work smarter. Digitalization, when done right, is a force multiplier. It is not just for productivity, it is for a purpose. The future of nursing is not digital, it's human empowered digital. Thank you so much. Thank you for this opportunity.
Thank you, Mr. Sadi, for a very wonderful talk, and I think we must give him a great applause for him and his team and Devi Memorial, who has done such an incredible job in creating so many pathways for nurses to improve on their patient outcomes. I think you have done an incredible body of work, and really congratulations for that. And I think these innovations, I wish there were more software engineers in the health field attending this who could also take it up for their hospitals. And both the speakers have given a fantastic and very well-rounded talk on their topics. So let us give them a great round of applause. Louder! Thank you.
Thank you to our wonderful moderator and to our faculty for the very insightful session on digital transformation, determinant of the future of healthcare. We'd now like to capture this moment. Please join us to the left of the stage for a quick photograph. And that brings us to the close of an inspiring day.